Research Symposium series. And the theme this year is strengthening community academic research relationships. This is our fourth such conference. We held it in 2018, 2019, 2020. We skipped 2021, but we are back this year with a whole series. And today we're going to be focusing on LGBTQ health equity. Next slide, please. So first, I'm going to ask everyone through the presentations to everyone, because this is not a typical webinar. This is a large Zoom meeting. Unless you are presenting or one of the main presenters, please stay muted and keep your cameras off during the presentations. We do have people in the background who will do that for you if you're not able to do it yourself, but we appreciate your cooperation when it comes to that. Next, I'd like to do a land acknowledgement and to honor the legacy of Native peoples. Wayne State University rests on Wawayatanong, also referred as Detroit, the ancestral and contemporary homeland of the Three Fires Confederacy. These sovereign lands were granted by the Ojibwe, Odawa, and Potawatomi and Wyandot nations in 1807 through the Treaty of Detroit. Wayne State University affirms Indigenous sovereignty and honors all tribes with a connection to Detroit. So thank you for allowing me that. Also, I'd like to give what we call, and we've done in the past, a radical welcome, particularly for everyone, but for members of the transgender, non-binary, and gender non-conforming communities. Please remember that a person's purposeful gender expression or external appearance may not match their internal gender identity. People often introduce themselves with the pronouns they prefer. It's in our little names within the squares, within our photo squares within Zoom as well, so that can guide you. If you're not sure, feel free to use they, them. We won't think you're using incorrect grammar. And I apologize because I didn't identify my own pronouns, she, her. So feel free to do that and introduce yourself in that way. So next slide. I'd like to acknowledge symposium organizers. The first I mentioned was Checkup. I mentioned already is Checkup, the Center for Health Equity and Community Knowledge in Urban Populations. It was established in 2021 here at University with the support of our Office of the Vice President of Research. And our goal is to accelerate community academic partnerships to address health inequities. And really, we value community input on all levels of our work. And we strive to do this in an anti-racist way. We strive to do this in a transdisciplinary way as well. And you have our website there, checkup.wayne.edu. Our second organizer is the Karmanos Cancer Institute Office of Cancer Health Equity and Community Engagement, and called OCHEEC. And that has a similar purpose in terms of bringing in community members in all parts of our work and our research at the Cancer Center. Our website is there as well. Next slide. I mentioned that this is the beginning of a symposium series. So today we're doing LGBTQ health equity. Next month, we'll begin focusing on Black health and racial equity. And in November, Middle Eastern, North African, refugee, and immigrant health, Minari health equity as well. So please, I hope you can join us for those programs as well. Next. So I'd like to acknowledge my symposium co-leaders, and I'm going to turn it over to them so they can say a few words. First, let's go to Lisa Braddix, who is the chair of our Checkup Steering Committee. She is also the Chief Health Equity Officer of the Southeastern Michigan Health Association. Lisa?
Good morning, everyone. Like Dr. Thompson shared, my name is Lisa Braddix, and I just have to say that it is an extreme honor and privilege to serve as Checkup's Steering Committee Chair, and to just be here and watch all of this collaboration and all of the interest surrounding the work that's being done at Checkup. And so we are just very excited to kick this series of symposia off. You saw the wonderful plans that we have for the rest of the fall for the today, as well as the subsequent meetings that are scheduled for October and November. Very focused and very purposeful meetings, really focused on health equity and bridging that gap between what's going on in community and what's going on in academia. So just very excited for the wonderful ideas, the collaboration, and all of the things that are going to come out of these symposia. We're looking forward to just some awesome discussions and awesome partnerships moving forward. So welcome, everyone. I just encourage everyone to just really engage and to not be shy and open in sharing your thoughts and ideas. And this is just the beginning. I'm so excited. So welcome.
Thank you, Lisa. And next, I'm going to turn it over to Dr. Carrie Leach, our Associate Director for Community Inclusion at Checkup.
Thanks, Haley. Good morning, everyone. Welcome. I'm so glad that this symposium is back together. And just to build a little bit on what Haley and Lisa said, I would just make the note to ask everybody to be reflective this morning before we get going in a process that we're labeling or borrowing, which is step up and step back. If you're the kind of person that doesn't often share in meetings or likes to percolate on things or make notes, please do share those thoughts if you don't get them out while you're here in the chat, or jotting them down, sharing them later, putting them in the evaluation. But also, if you're the kind of person that tends to dominate a conversation, we would just ask, for those of you that tend to step up, maybe step back. And for those of you that maybe step back to step up, we really want this to be very interactive, and we want to hear all of the information that we can. We want to move science towards equity, and that really involves us listening. And we're not leading with science. We're saying this is where we're at and where do we need to go. And we can't do that without everybody involved and without all the involvement and engagement in this, which we really feel confident that these programs have been set up for a very interactive process, which is very exciting. So please do be as engaged and involved as you can. And welcome. We're looking forward to a great day and programs going forward. Thanks, Haley.
Thank you. Next slide. I would like to just acknowledge the checkup team. I think that's the next slide. Thank you. First, Alex Sass, who is our manager for research and operations. We give a tremendous thank you to her because she really has kept the train on the track, particularly in terms of this symposium and the planning of it. And she's also in charge of planning the other programs as well. So she has a lot on her plate. We're just super grateful to her. Also want to acknowledge Asha Freeman, who is our manager for training and capacity building, and Ali Faki, our program assistant, who has also worked closely with Alex on this work. Also like to acknowledge Christopher Johns, who is definitely behind the scenes, but just a really critical piece of making everything move smoothly today. So thank you, Chris. Next. So we're going to get moving today with our program, we're going from 11 to 4. And as everyone mentioned, this is something that we hope this is not a traditional meeting where people are just talking at you. We want to hear from you. We want feedback. We want this to be really interactive. So relax and, hopefully you feel free to share. And share your opinions, share your thoughts. I want to acknowledge our planning committee, our two chairs, Keith Hughes and Rick Zimmerman, Dr. Zimmerman. Also want to acknowledge Heather Walter McCabe, Zaire Kwebena, Megan Landry, Patrick Yankee, London Hudson, Evan Killingsworth, Sarah Kuiperman, Patricia Wren, and Dr. Lloyd Allen. Thank you all. They worked so hard to bring this together only over the past few months. So it came together pretty quickly. Thank you all so much, so very much. Next, I'm almost done. And I also like to acknowledge all our symposium partners: LGBT Detroit, Detroit Community Health Connections, Cortown Health, American Cancer Society, the Michigan Department of Health and Human Services, the City of Detroit Health Department, and Wayne State's Law School, College of Education, School of Social Work, College of Liberal Arts and Science, and the College of Nursing. And with that, one more thing. Even with all this planning, this is not the end. This is not, this may be one peak, this meeting, but we want this work to continue. We're going to do a lot of talking today. We're going to be identifying priorities in research and programming, and we want this work to continue. And our checkup, our Center for Health Equity, has funding to support that work. So if you are interested in participating in an ongoing work group after today, contact Alex Sass at alexandra.sass@wayne.edu, and we can make sure you're involved as we move forward together. And with that, I'm going to turn it over to our chairs, Dr. Rick Zimmerman and Keith Hughes.
So I can go first. Good morning, everyone, again. My name is Keith Hughes. I am the Senior Public Health Educator for the City of Detroit Health Departments in the HIV Epidemic Initiative. Just a little background about me. I have been working in the field of HIV for 14 years. I started off from nonprofit. I have a very strong passion around HIV prevention. I do have some experience with working in HIV care, group facilitation, and also advocacy work under the umbrella of the Black AIDS Institute. And Rich, if you want to go behind me.
Sure. Rick Zimmerman. I'm the Associate Dean for Research here in the College of Nursing at Wayne State. Welcome, everybody. My work actually has also been primarily in HIV prevention, actually for the last 40 years. And we've done media campaigns, school-based campaigns, community campaigns. We've worked with LGBT youth in our research and currently doing some work to support transgender women to be more successful in the mainstream workforce. Glad you're here, everybody. Keith, you want to tell us a little intro about the symposium?
Yes. So just to give you all some background around this this particular symposium, we are working on possibly in the future putting together some workforces, some planning bodies that will help create some longevity to the conversations that will be produced today by you all. And also probably putting some work together with putting together some innovative projects and also some advocacy work to kind of get some of this conversation and dialogue up to the higher ups around policy change, and also developing some more innovative programming like we're doing with the city of Detroit and the HIV epidemic initiative to provide some more innovative services and programming to better cater underserved communities that are being impacted not only by HIV, but also social determinants that could also increase that drive and vulnerability to acquiring HIV. So just to move on, the next piece that we'll be doing is the introductions and the icebreaker. So this piece is going to be more so focused around you all just to kind of break bread with everyone. So we'll have a series of breakout rooms where you all will be able to participate in. There are some questions that have been added to the added to the chat. This is kind of form building that relationship with you all in these breakout rooms just to get an understanding of organization or college you all may work with or a part of, also the work that you all specialize in. And the bigger piece is what do you all hope to get out of today's conversation, and what are your hopes for the community as we move forward with the work that we are currently doing. So
thanks, Keith. Just before we start the breakouts, the icebreakers, I just want to give a quick overview of the rest of the day. So after we do the icebreakers, and that will happen automatically, we have magical folks who can send us into all different kinds of groups with each other. Then there are 4 topics that we're focusing on today. And those topics are social determinants of health policy, access and equity in major health needs. They will comprise 4 sections of the day. For each of those sections, there'll be a very brief presentation from somebody in the academic community, and then a slightly longer presentation by somebody presenting community voices and perspectives. And then for the first group, you'll be randomly put into one of several breakout rooms and have 30 minutes to discuss what you heard and other topics that you think are related to that topic. Always thinking towards working towards action items by the end of the day. Then the next presentations will happen. You'll be put back into the same group, and you'll have 30 minutes to talk about the next topic and think about priorities, and so on during the day. And then at the end of the day, each group will be tasked with help by facilitators and note takers to determine priorities for going forward. And the very last session today will be all the groups reporting back to the entire symposium about your priority items. So our focus really is not just on today, as Keith said, but on hopefully keeping the things moving forward toward real action items that can make a difference in the LGBT community.